welcome to Fairview Range Focus. I'm David Hall, Senior Vice President with Fairview Range. In this monthly program, we talk about healthcare topics that are of interest to the communities we serve. And today, I am joined by Dr. J. Hildenbrand, chiropractor with Fairview Range, and we're going to talk about chiropractics and learn a little bit more about that. So, thank you, Dr. Hildenbrand, for joining me today.
Oh, my pleasure.
So, let's start, and maybe you could just kind of talk in general terms about what is chiropractics? What is a chiropractor?
Yeah, for most, if they have never been, they have a lot of questions with that. So first of all, we deal a lot with the spine, spinal-related issues, nerve impingement. We deal with the spine, detecting nerve pressure that can cause multiple conditions, which maybe people aren't even familiar with. So a lot of times we're feeling the spine, see how the joints are moving, see if there's any dysfunction going in the spine.
Okay.
So
how about the profession of chiropractics itself? How does one become a chiropractor?
Okay, the education, you typically get a 4-year degree first at a 4-year college, and that can be in a variety of different degrees, mostly biology, anatomy, that sort of thing. I got my 4-year at University of Minnesota Duluth in biology. And then you apply to go into the college, and that's another 4 years. And there you get a doctorate in chiropractic.
Okay.
So.
And do you do like any kind of residency or your training as far as clinicals and everything?
Yeah, with that 4 years, the last year is you do a 1-year residency or 9-month to 1-year residency in going to different clinics. I went to 3 different clinics along the way, and you just start with one and you can build up from there. Work a variety of different conditions with a supervised doctor.
Okay. So all told, you have over 8 years of higher education to achieve the level of becoming a doctor of chiropractics?
Yes. Yeah,
okay.
8 years.
That's a lot.
Yes.
That's a lot.
Yeah.
Okay. All right, good. And schools, is there schools in Minnesota?
Right, there's one school in Minnesota, Northwestern Health Science University down in Bloomington, Minnesota, and that's the only real close one. There's the closest is Iowa and Chicago, but Minnesota has a very good program down there in Bloomington.
And if I'm not mistaken, that's been around for a few years.
Yeah, it's been around for quite a few years. Changed locations, but now it's been in Bloomington for quite a while.
Okay. All right. Very good. So you're Minnesota raised and educated?
Yep, Chisholm, raised in Chisholm, Minnesota here. I went to Hibbing Community College for 2 years first, and then went on to UMD. So, yep. Great education. Loved it up here, and decided to come back to the area.
All right, great. We're glad you did.
Yeah.
So as a chiropractor, you talk about the spine and everything, but is there certain conditions or things that come to mind as far as the type of patients that you see more often than not?
Yeah, there's definitely a lot of times lower back is probably the number one condition that comes in my office. Lower back or sciatica. That's probably number one. Also, neck-related issues, neck stiffness, nerve impingement, even radiating arm pain can bring people into the office. There's other things that you see too, rib involvements, mid-back pain, but definitely lower back and sciatica is probably the most common.
It is.
The other condition, headaches. A lot of people with headaches out there, and we work a lot with that.
Okay. So what's the connection with headaches related to chiropractics?
What'll happen, a lot of times you get nerve impingement way up in the top of the neck.
I see.
And that can cause a lot of muscle spasm. A lot of people will say they have tension type headaches with the muscle spasm in the base of the skull, and then it can radiate around into the eyes or forehead. So, and a lot of times desk work with people, heavy lifting, can cause a lot of muscle impingement or muscle spasm and nerve impingement. Typing, desk work has got to be the number one posture. So, yeah, but work a lot with headaches on a daily basis.
Wow, that's really interesting. So you said posture. So posture can relate to your spine and headaches?
Yeah, very much so.
Okay.
Very much so. If you start leaning forward, all of a sudden the muscles have to pull the head back. And if you're working 8 hours at a desk, you start leaning forward, the muscles are working 8 hours to hold that head upright. So, yeah, it can, posture, I talk a lot of posture in my office with people.
So it sounds like you're not only treating patients, but also there's an educational component as well as far as trying to teach the right posture or techniques or...
Yes, correct. Because you can try to help somebody, but if they go back to the office and every day they're going back to the same old, what's been causing it, you have to try to get rid of those aggravating factors, whether it be neck pain, lower back pain, stretches. I try to talk to stretches on a daily basis with people to help themselves at home to get better quicker.
Okay, good. And how about accidents? Now, I mean, whether it's a fall or an automobile accident, do you see many patients, as a result of something like that?
Yeah, quite a bit. And it can be something minor, and you can get a pretty bad whiplash type trauma too. So, yeah, it can be anything from motor vehicle accident. I work a lot with motor vehicle accidents. That's a lot of times a huge high impact collision. So, but slips, falls. Right now, it's a tough time of year. It gets warm out for a couple hours, ice melts, and then it freezes at night. So people come out and they slip. So yeah, anything from slip, falls to car accidents.
Okay. Sports injuries?
Sports. Yeah, I love working sports. I've played sports my whole life. So yeah, I treat a lot of the sports athletes in this town. So.
Okay. So age-wise, then, I mean, I'm thinking of a lot of sports injuries are maybe younger individuals. Maybe you could speak to that as far as what age of the patients that you see or are comfortable seeing.
Yeah, sometimes I'll have a real young patient in my office, and they'll leave, and somebody will ask, "Why does young people have problems?" Well, they have the same spine as we do as we age. So yeah, I treat conditions from all the way from young to old, and a lot of times the older population will ask me, "Well, is it safe to be working on me even if I'm, definitely I don't work the same on a young person as I would an older person." So it's safe for all ages, and I do treat all ages. So,
you do?
Yes.
Okay. All right, good. And what about referrals? I mean, it seems like so much within the medical communities we're used to referral being necessary to go to see a specialist and whatnot. Are referrals necessary of any kind to see a chiropractic?
Right. No, not in too many cases. So people can just call the office. There's no referrals necessary. So many people think they have to go to their medical doc or a specialist to then get referred in, but you don't. I do like to work with the medical doctors so that everybody's up on what's going on with treatment and everything. But no referral necessary. But I do like to keep that relationship with their primary care.
Okay. All right. Good. Well, let's talk about that. I mean, how does that occur? I mean, I know you're part of the Fairview system. I mean, do you share records with them, or how do you communicate to keep them informed?
Right, we share records.
I see.
They have access to my records, I have access to their records. And the other question I get a lot is x-rays. If I go to the hospital or if I go to the clinic, I just had x-rays, can you pull those up? Absolutely, that's one nice thing with being with Fairview is I can pull up all their records and x-rays, which happens quite often. I want to see their x-rays or MRI, or even compare if they've had a couple MRIs. So yeah, we can pull up all the records, and then if there's questions, then we can also call the medical doctor.
Okay. Oh, that's really convenient, I'm sure, as a practitioner. I mean, for you to be able to access the records and.
Yeah. Yes, absolutely, and do what's best for the patient. If a treatment's been done, look into other options, or try to help the patient the best we can with that. So.
Okay. Maybe you could talk a little bit about, from a safety standpoint. I mean, we're all concerned about our safety and having, whether it's a procedure, a surgery, or something less invasive. I mean, what's safety like within the chiropractic? Is it considered very safe treatments?
I get that question a lot too. I mean, the spine's important.
Yeah.
They don't want to do anything unsafe, but absolutely safe. Like I said before, we don't treat everybody the same. So if the spine's a little more fragile, yeah, you're going to do a much less aggressive treatment than you would on a big football player coming in the office. So it's very safe, very effective, non-invasive.
Okay. So what might someone expect if they were to come to see you for the first time? I mean, could you kind of describe maybe what a typical visit might be like on the first time?
Sure. The first time is a little long because you want to get to know the person, and you want to go through an exam. So first of all, you sit down with an exam. Also, if there has been any x-rays or MRIs, I have access to that, so we pull that up just so we can get familiar. If there's something of importance that I want to get an x-ray first, we will refer over back to the clinic to get x-rays or potentially an MRI. But if everything's good with that, then we go through an exam to see what's going on. Because a lot of times where they think their pain is, it could be radiating from another area. So you have to dive into that and see where the issue really is stemming from. So we go through an exam, go through muscle testing, and then if they're okay with everything and I find what's going on, then we'll go ahead with treatment.
Okay.
So,
So the evaluation, that sounds like it might take you a little bit longer the first time. How long
yes.
do you think it might?
Typically the first visit, about a half hour,
Okay.
depending on if we have to go through x-rays, MRIs and all that.
Okay. So then after, maybe if there's a second appointment, how long might that take?
Usually 15 to 20 minutes,
Okay.
depending on the condition.
Okay.
Hmm.
So, I mean, from my own personal experiences, I know sometimes, back injuries can be painful.
Yes.
For treatment, is it typically a painful experience, would you say?
It varies so much.
Okay.
It varies so much. A lot of times, if somebody is in extreme pain, they can't stand up straight, they may have even difficulty laying down onto the table. So in that case, sometimes it gets a little tender, but you work with what you can, but typically not. I mean, most of the time, a very painless procedure. In fact, most people are very appreciative during and after the treatment.
I'm just guessing that over in your career that you've had some maybe pretty amazing results in some patients that you've treated, where they've maybe been quite debilitated and gone through treatment. I mean, without obviously talking about names of individuals, can you describe maybe a condition or something you've treated where you've seen great results?
Yeah, again, probably the most important, lower back pain is probably the most common coming into my office, and it's when you can help somebody that really can't walk straight or walk for a long time, or give them some of their activities of daily living back. I mean, that's very important to them. So it's.
So you've seen that happen where they've been to the point where they couldn't do their daily living activities.
Yeah, right.
Okay.
Correct. So to give some, maybe he wants to go play baseball with his son, or she wants to go for a walk with somebody. So yeah, you give a little bit of their life back, and they're very appreciative to that.
Oh,
so,
I bet.
Yes.
I bet. Okay. How about medications? Do you prescribe medications at all? Is that ever necessary?
Sometimes necessary. I do not prescribe any medications, and that's another good thing of working close with their medical doc. Sometimes it's needed, and we refer back to their medical doc for that. So I don't prescribe any medications, but have a network that we work well with.
Okay.
So,
how about insurance? We're all interested in insurance and what our insurance covers, and does insurance typically pay for chiropractic care?
yes, most do, and again, being with Fairview, they take so many insurances out there. Again, I get this question a lot with Medicare. Senior citizens ask me, do you take Medicare? Absolutely, we take Medicare. We take all the major insurances. They cover. Every individual has different coverages, so you have to call your insurance company to see if chiropractic coverage is covered, but most of the time it is. All the major ones like Blue Cross, Medica, and Medicare, yes, we take.
Okay. When you described like the length of the appointments that a person might have, would you say there's a typical as far as the number of treatments that an individual? I'm sure it varies from one to another, but anything average that you see?
Great question. Everybody is so different, so it averages from one to, it can be a couple weeks, couple months.
Okay.
It varies so much. And that's typically why I do a lot of education with the parents or patients, telling them what they can do at home to help themselves along the way. But yeah, there's no set guidelines. Everybody coming through the door is different, so you got to work with the patient.
Sure. Sure. Okay. We talked about education, and I just know, I mean, how important spine is to our health and to our well-being. Is there things that you can share with us as far as that, maybe what some techniques as far as how do we keep our spines healthy? Is there things that we can do to prevent injury? Can you speak to that?
Yeah. Core strengthening has got to be number one. I mean, there's so many factors out there in this world right now, but core strengthening can absolutely help a lot of lower back, neck conditions. So there's a variety of different, going to the gym, doing your sit-ups, crunches at home,